www.pills24.online. Number 1 online pharmacy shop. Buy drugs without prescription. Big choice, cheap prices, fast worldwide delivery. When type 2 diabetes treatment fails, what's next? Sometimes type 2 diabetes treatment comes up short in controlling your blood sugar. If that happens, take these steps to create a new treatment plan. For most people, type 2 diabetes changes over time, even for those who follow their treatment plan exactly as directed. As the disease progresses, your diabetes care team can help you adjust your treatment plan and manage your blood sugar levels. If a change is needed, your doctor may add new diabetes medications or suggest starting an insulin regimen. This doesn't mean you did something wrong. Shifting gears is a natural part of managing a changing chronic disease like type 2 diabetes. There are a number of factors that can contribute to a decline in blood sugar control, says Margaret Powers, Ph.D., Rhode, CDE, past president of Healthcare and Education for the American Diabetes Association and a research scientist at the International Diabetes Center at Park Nicollet Health Services in Minneapolis, Minnesota. When type 2 diabetes first develops, you may be insulin resistant, which means you make a lot of insulin but your body can't use it effectively, Dr. Powers says. Then, over time, you make less insulin and become insulin deficient. This is seen a lot, but it doesn't happen overnight, it's a gradual process, says Powers. Other factors, including a significant change in weight, activity level, or diet, or starting new medications, can also affect blood sugar, she says. Stress is another factor that can impact your treatment. An additional illness or a major change like a divorce, job loss, or a loved one's death can increase stress, which can raise blood sugar. These life changes may affect how well people take their medication, says Susan Weiner, RDN, a certified diabetes educator in New York and the 2015 Educator of the Year of the American Association of Diabetes Educators. Before, there may have been someone who helped motivate and support the person with diabetes. And daily diabetes self-management can be challenging even under the best of circumstances, she says. If you do need to change things up, it doesn't necessarily mean you'll need to adjust your medication regimen. It may just be a matter of refocusing on your food and activity plan, as well as reducing stress. Consider taking these steps to get your type 2 diabetes treatment back on track. Watch your A1C to gauge treatment success. An A1C test measures your average blood sugar readings in the 2 to 3 months before the blood test was taken, according to the Joslin Diabetes Center. Generally, a reading of less than 7% is optimal to prevent type 2 diabetes complications, but talk to your diabetes care team about your personal A1C target goal. While A1C tests are a good indicator of how well treatment is working or not working overall, Powers explains that because the A1C reflects on average, you could actually be experiencing many highs and lows, even if your A1C result seems to be normal. That's why at-home monitoring as prescribed by your doctor is also important. It shows blood sugar levels on a day-to-day basis. If your numbers aren't consistently within your target range, you may need a change in treatment. According to Powers, there are 4 critical times to have your diabetes self-management plan assessed. When you are newly diagnosed. Annually. When complicating factors occur. When you have transitions in care. There are many factors that can affect your A1C, so it's important to review your diabetes management plan regularly so you don't miss the opportunity to do what's best for you. Work with your doctor to adjust treatment as needed. Metformin is a typical first medication for people with type 2 diabetes, says Powers. It works by decreasing the amount of sugar the liver produces and by making muscle cells more sensitive to insulin so sugar can be absorbed. If it no longer works for you, another drug can be added. But there's no magical second drug. The secondary options will depend on the individual, she says. Other medications work to lower blood sugar in different ways. For instance, some trigger the pancreas to release more insulin, while others work in the intestines to block the breakdown of some carbohydrates or in the kidneys to increase the amount of sugar excreted in your urine. Your doctor may suggest adding one or more of these to your medication plan. You'll know your new medication is working if your A1C numbers shift down toward your goal. Still, Powers stresses that diabetes medications won't work on their own. It's also important to make lifestyle changes like distributing carbohydrates evenly throughout the day to get the best diabetes control, she says. If you've had type 2 diabetes for many years, there may come a time when the medications you've been taking and lifestyle changes you've been making might not work anymore. As a result, insulin injections may be needed as a second line of treatment in people with type 2 diabetes whose A1C numbers are very high, Powers says. Work with your healthcare provider, who will be able to recommend the best way to adjust your medications and insulin dosage so you can continue to properly manage your type 2 diabetes, she says. Stay positive when type 2 diabetes changes. Don't feel like you're in this alone, Weiner says. Reach out to a friend, family member, healthcare provider, or certified diabetes educator for support. Additionally, take measures to manage stress. Recharge and do something you enjoy, take a walk, cuddle a pet, listen to music, or treat yourself to a massage, she said.